bring in our guest, Miss Taylor Weathers. Welcome in.
Thank you for having me.
I'm so glad that you're here because we get to kind of dive in a little bit deeper. So tell me more about the PICU. What sparked this project?
So for a long time, East Texas has needed a PICU. Traditionally, we have sent kids that have needed a higher level of care, and they've had to go to the Metroplex, either to Dallas or Fort Worth, or sometimes that's even Houston or Shreveport. So we're now able to offer a higher level of care for our kids here and let them be closer to home and heal closer to home and be closer to their families to where they're not as displaced as they have been in the past.
Well, with that said, how did this come about?
Well, it's really just identifying the need. So as an organization, we've talked about this project for years, and finally we've been able to put something, an idea to pen to paper, and then, to be able to open now and offer the service.
That's actually really cool. Well, how has the first month been? Because I know I just asked you right before this too, how has it been? Have you guys been, busy? How has it kind of been so far?
It's been a really good first month. So in the first 4 weeks, we've seen about 50 patients. So their length of stay will average from a couple of days, and we've had a couple patients that have been there for a few weeks at a time. So 50 kids so far that have gotten to stay local, be close to their families, and that didn't have to travel to the Metroplex.
Well, that's really good that you guys have been, somewhat busy and active in there. So Christus has a PICU in San Antonio. If people don't know about that, just kind of letting them know, how have you collaborated with them so far?
Well, they actually played a large role in helping us get the doors open. So while we were working on our actual department and getting the renovations up and running, we took our staff that was hired on for the PICU and we sent them to San Antonio for training. So they have a great PICU down there, and so our nurses, if they either had pediatric experience, they went down there and got critical care. If they came to us with critical care experience, then they went down there and got the pediatric aspect of it. So a lot of hands on deck with helping us get this up and running. We were able to make the department what we wanted to from a local level and kind of cater it to our community and what our needs were. But we did have a lot of support from our organization as well, and then from the Children's Hospital down in San Antonio.
Well, that's good. I know you kind of touched on this, so I'm going to kind of deter from this question and ask you a little bit about the growth. So I know that they helped you grow and get started, but what are you expecting from the growth in the future?
Really, our biggest focus right now in terms of growth is getting more beds. So right now we will eventually be a 10-bed unit. Right now we're starting with 4. We'll go to 6 soon, and then to 8, and then to 10. Our growth, or really our plan for the future, is to grow beyond that as well, if possible. It's kind of a if you build it, they will come model, and so far that's already been proven to be true in this first month of being open.
Nice. Well, tell me about the kinds of patients that you've been seeing in the PICU.
Well, since we're in January, we've had a lot of respiratory kids. Usually when kids get sick and if they go downhill, it usually has something to do with respiratory. And so that's what a lot of the kids have been coming in to see us for. So a lot of need for supplemental O2. We've also had some DKA patients, some sepsis. So really respiratory has been the most frequent type of patient that we've seen.
Yeah. Well, with that being said, what are the various illnesses that have been coming through besides those?
A lot of RSV, some flu, really a lot of pneumonia. This has been a heavy respiratory season so far, but really our viral illnesses and then some pneumonia as well.
Okay. Well, how do I word this? Where are most of the patients coming from?
A couple different places. So they can come in through our ER.
Okay.
Our ER is a great at taking care of kids, and if they decide that they need to be admitted, then they can come over into the PICU or even the acute pediatric floor. So we admit from the ER, but then we also get a lot of transfers in from the region too. So different hospitals and facilities within East Texas, and really a little bit beyond that, we've gotten some kids brought to us from them.
That's good too, because that means they're seeking the help that they need, especially when they're not feeling well, not doing good at all. What are families whose children have spent time in the PICU saying?
This is actually one of the best parts of the job is hearing from the families that we get to impact. I know that having a new department, sometimes there's a little bit of uncertainty because you're in a new place. The feedback that we've been getting from the families is that they're so thankful that they're able to stay here. The trust that we've developed and the trusting relationship that we've developed with them has also been something that we've been getting feedback on, and it's been really good to hear from them and to know that now that they have a resource here that's close to home that they can trust, and that they've trusted Christus before, but now that they can trust our new pediatric ICU as well.
That's nice. So I know we already touched on the future, obviously. Is there anything else that you want everyone to know about this?
Really, we just want everybody to know that we're here, the services that we offer, know that our growth in the future is growing in beds like we talked about, but really also growing our specialties. So we're working really hard on getting more specialties on the provider side. So right now we do have pediatric GI, we have pediatric surgery, we have endocrinology that's specific for our kids, and so we're just trying to grow those capabilities too so that we can keep more kids here that usually have to go out of town for those services.
That's awesome. All right. Well, thank you so much for joining us and giving us the latest. It was so nice to have you on, chat with you, obviously meet you. I'm sure we'll talk again at some point, and I hope all is well in the future.
Okay. Well, thank you. Thank you for having me.
All right, everyone. We are now going to go ahead and take a quick break, and we'll be right back here on East Texas Now with more right after this.